Thank you to all the frontline and health professionals. Thank you for your services. And this past year, as everybody knows, has been very challenging. So I really thank you for spending this time with us, to your family. And so today we are going to have three panelists who have joined with their busy schedule, and they're going to inform us about the COVID and the COVID vaccine. Please mute yourself, and throughout the session, if you have any questions, please write it down on the chat, and me and Meena Jain will able to ask those questions for you to the panelists. So Meena, thank you.
Good morning, everybody. Jai Jain. So what we will be, the format of this, the presentation will be that I'll be introducing each physician one at a time, and they will speak for 15 minutes. So we'll have like a presentation for up to about 45 minutes. Then, as Shilpa said, we will be moderating the chat sessions. So put your questions in the chats, and I'll be reviewing the questions, and then we'll make sure to answer them at the end. So we'll allow quite a bit of time for question and answers, and hopefully it'll be. And by the way, my name is Meena Jain. I work with Shilpa and in the Today's Woman, Today's Girl group. So the first speaker for today is Dr. Geeta Shah, and she's an infectious diseases specialist. And so we are going to have her presentation up. I'm going to turn off my video and mute myself, but I don't know who's managing the videos. So the slides. If you could put the slides.
Sahil is going to start sharing the slides.
If you could share the slides, yeah.
Jai Jinendra. So today we are going to talk in 15 minutes. Each of us will say something about COVID-19, which hopefully is useful to all of us. There will be lots of questions, I'm sure, and we should be able to answer to our best capability. COVID-19 is with us, as we know, since at least December 2019. And still we are struggling with it, but finally looks like there is a light at the end of the tunnel. I want to show you a few things, and other two panelists will be complimentary. And I'm sure we can talk on COVID-19 for hours, but let's overview of some of the things which might be helpful to do the thing. So let's see the global epidemiology. And let's go, global epidemiology is saying that COVID has not left anybody out from this horrible infection, and the sequela from there, where we knew nothing, books were not written. In fact, books are being written right now as we move forward. And it's amazing, medicine itself is amazing, but this is affecting millions of human lives. Next one. And let's talk about what is happening in US. And as if I think day before yesterday, there were a total of over 23 million cases. And as we know, unfortunately, 392,000 or even more today. I don't know today's number, but it's increasing every day. And the goal is to prevent this mortality and morbidity, and that is the most important thing. Now, down there shows a different state, and few of the state shows that where the numbers are really still going up, and what we can do about it. But we saw that from March or April, this curve has gone up slowly, even though the waves, it has happened in the waves, but now we are still in upward trend. And same thing is death over the time. However, for percentage of the death has gone down because of the new availability of some of the treatment, which my other colleague will be talking to you. Next one. And this shows that how hospitalization happens depending on the age, race, and ethnicity. And that has a lot to do. And as you know, that it has affected more of the Black and Latino community overall. Asians are down there, but still it has affected a lot. So this is the slide that show also that what happens as the person keeps on getting older. And we all know that older population has been target more of this infection. Next one. So this everybody should know by this time, but I thought it will be a good reminder for us because even after vaccine, we are supposed to practice this and how the person who is infected on your left side can transmit the infection to the person who is not infected or has not had any COVID exposure before. And these are the common sense things which we need to practice. And it shows that even smaller particle in the air can last, suspend for a long time. And then, of course, we all know 6 feet or more than 1 meter distance. And then it's a droplet from the person who is infected, how it goes to the other person, as well as it sits on the environmental surfaces. Urine and feces also have the COVID virus detected. And as we know that some patients may present as GI symptoms and not necessarily always with cough and low oxygen level. Next one. So this is same thing. What we need to be very careful while coughing, sneezing, singing, talking, breathing, but to cover ourselves. And again, we need to make sure that we have enough distance between the people. That's why overcrowding is absolutely prohibited. And we need to cover ourselves with the appropriate measures. Again, these symptoms, virus rarely culture from the respiratory samples after 9 days. So this is especially in the mild disease. To say that this disease happens in a different mild, severe, or moderate, and or a person can be asymptomatic or pre-symptomatic. So next one, viral load has a lot to do on the infection and spread of the disease. So this particular slide shows outdoor versus enclosed setting. And again, it has been proven over and over again that outdoor, there is less transmission versus indoor. And it shows that in the enclosed environment, it is 18.7% higher compared to the open air. In fact, there are different numbers you have heard, more than 10, more than 5, but in fact, this particular slide says even more than 3 people. So most important thing is should maintain the distance between the two individuals. Next one. And this is just the perfect example of that. That person infected with the COVID here can spread in different number, but definitely on the same table, more people are involved compared to this. But if it was far away, then these individuals were not infected. And same thing goes true for the air conditioning. So again, this slide shows that what is the importance of having the open air versus poor ventilated areas. Next slide. So these are the non-pharmacological prevention intervention, but I want to say these are the common sense preventive interventions or measures washing hand with soap and water, and everybody knows that. Quarantine close contact or infected individual, and then keeping the social distance and wearing the facial mask or cover with the cloth in public, avoid crowds, close contact, and poorly ventilated spaces. And that is the reason not to go to the closed places like restaurants, etc., or even the temples and churches has been included in that. Next one. So this is a hospital. Again, I think I showed this in the bar. So this is showing again that Hispanic and um, uh, Black people are how they are affected more. Next one. So these are the common symptoms. And these are really the symptoms which most of the patients have come to the hospital with or at home or communicated with their healthcare provider. And these symptoms can last from between 2 to 14 days after the exposure. It's obviously headache, fever, new loss of taste or smell. And this is one of the symptoms which had been described little later in the time, but now it is well known, and quite a few patients do say that congestion and runny nose. And in spring, everybody thought it was allergy, but in fact, it can present just like that. Cough, sore throat. So these are the common, except the loss of taste and smell, these are the most common symptom people try to ignore because it happens all the time or frequently. Most important is shortness of breath or difficulty breathing. And I'm sure most of you at home now have a pulse oximeter at home where your baseline pulse ox, and then if you have any symptom or concern, you can follow that. Fatigue is one of the most important, just like flu, fatigue, muscle ache, and body ache, fever, chills. And the GI symptoms are these: nausea, vomiting, diarrhea, which were not included initially all the way in March and April, but later on, as we knew more and more, now these symptoms are included in the COVID-19 symptoms. Next one, please. I think these are the same thing. It describes by age and sex that young patients have different symptoms than the elderly patients. Women may complain little bit different than men, but basically 11.5 days is the time, and most of the patients by then have the symptoms. Next slide, please. And let's talk about most important thing is vaccine now. And next one. And there were 3 phases of a vaccine, as you were aware of, or in the beginning, phase 1, and this was really thanks to the pharmaceutical and leadership and whoever was involved. First phase, this is, they make sure that there are not immediate serious side effects, and is it causing any immune response? Then the phase 2 comes where more people were involved. Initially 2,200, but then several hundred. And here again, is vaccine, there are any signs of vaccine being protective? So, and the body's immune response, all along side effects has been measured. And the phase 3 is the one, there are thousands and different numbers are with different companies, and how it is affecting and what vaccine this vaccine protect people from the disease. And now we are in the phase 4 where emergency authorization has been approved, where millions of people will get the vaccine, and we will have new data coming out from that. It is only month, I think December 14 was the first day when vaccine was started, next one, and it is over a month, and some some of the individual or healthcare worker have already gotten 2 doses. So there were 154 vaccine to start with, and with phase 1 and 2, so many dropped out, and then 20, and then phase 2 had only 16. Phase 3 has 13 vaccine, and only 2 vaccine is approved. End of the month, or beginning of next month, there might be 1 more vaccine might be approved. Next slide. And this slide you can review on your own. It's very good slide in the sense different mechanism is involved in each vaccine. And down here, we have right now Moderna and Pfizer, and it is mainly mRNA. mRNA has been working, and it is causing the virus. It blocks the virus and teaches the body to fight back. But there will be the next one will be viral vector, which is Johnson and Johnson and AstraZeneca, I think. And there they use adenovirus and then put the inactivated virus on that. But this is a viral vector which produces totally different mechanism. And this we do not have here, but other countries do have that. Novavax may happen here, but I don't know when. Next one. Each company has how many participants has been used in the different studies has been shown in this slide. Next one. And this is, right now we have mRNA, and what I hear or what I know up to today, that it can prevent 100% of the severe disease which puts you in ICU or die. It does affect 90% for all disease that is mild through severe, and it does have protectivity 70 to 80% against the infection, but you can still be having the virus in the your system and spreading to others. And these are the 3 different ways. This vaccine in US, there are going to be 6 companies, and each one mechanism will be used for those companies. And right now we are on number 3 with present, and next one is going to be viral vector, and then will be the protein base. And the whole idea is the immune system produces antibody in the body, in our body. And this slide shows different requirement for the storage. As we know, this is the biggest issue right now, but hopefully Johnson and Johnson will be kept in regular clinics, so patients will be, or people will be able to get. These are the common side effects. The most important, you need to let, when you go for vaccine, and if you have allergy, and if you use EpiPen, you need to let your medical history known to your provider, so they can watch you really for longer period of time. Right now is 15 minutes and 30 minutes, but that is standard. But it can be more. And if you really have concern, then talk to your primary care doctor. And right now, as we know, 2 doses, and eventually it can be 1 dose. Next one, please.
Geeta, just to make sure that we have enough time for the other speakers, are we almost done?
I'm done almost. This is where you monitor. Next one. I think I'm done. And this where we are here, and other countries are ahead of. Next one. And we need to continue same practice, what we are doing now after the vaccine, until all the population gets vaccinated. Next one. I think there are frequent question and answer. We will answer these when the all the individual questions come. Okay, thank you.
Thank you, Geeta Ben. Thank you. We really appreciate that informative talk about the rate in which all COVID has progressed. So next, I'm going to introduce Dr. Kinjal Sheikh. He is Chief of Critical Care at Northwest Hospital. He's the Director of Medicine for Medical Education and Clinical Chair and Professor of Medicine at Trinity School of Medicine. He's been in the Baltimore area for the last 6 years, and so thank you very much, Dr. Sheikh, for participating, and I will mute myself now. Thank you.
All right. JJ and everyone, thank you for having me. First, I kind of just wanted to start off and say excellent presentation, Dr. Geeta. That was, I think, very, very informative for everyone. So I want to appreciate you for doing that. Second of all, obviously the three of us are considered experts, but I think one thing that everybody needs to truly understand is that we are as much experts as really anybody can be. As Dr. Geeta said, this has only been around since 2019. So when we talk about coronavirus, that is a similar family of viruses that we talk about when you have a common cold or other things like this. This particular strain is vastly different and it's very new to all of us. So we do not really understand a lot of things. And so I think when you hear a lot of information from people and they say that they are experts, you have to understand that nobody really knows. We are still learning an extreme amount. And one of the things that I wanted to kind of first touch on is just what's happened over the last year for me personally, and I think for everybody. So obviously this has changed our world upside down. And one of the things that, we have seen as frontline staff is that, day in and day out, I am working with COVID patients and being in an ICU. Unfortunately, we've seen a lot more death than we would have ever imagined from one particular disease. And so it's affected every aspect of our daily life. And so when we talk about all of these things, it's not, we are literally seeing this. I think for a lot of people, it's something that you hear about on the news and you hear these vast numbers of, 400,000 deaths, or somebody might have tested positive. But how does it really affect me personally, besides the fact that I can't go, to the mall anymore, to go out to eat restaurants, to see my friends? Is this really, really happening? And I will tell you that as someone who sees this day in and day out, it is definitely happening. And it is not something that, that's just overblown or just like the flu virus. For example, when we talk about, everybody wants to compare this to the flu because this is what you hear about. Well, just this past, since September 2020, we've only had about 1,000 cases of flu. And the mortality rate has been very, very low, meaning people dying from flu has been exceptionally low this year. And why is that? Because we've been doing the normal things of wearing a mask, socially distancing, washing your hands. So that's an effective prevention for flu. And it's also an effective prevention for coronavirus. However, despite that, you still see the increase in number of cases and the number of deaths. So this is not like the flu. This is much, much, much deadlier than it is. So this is not something that we've ever seen before. Again, to go back to, something about being experts. When we only do this for 1 year, when we talk about heart attacks, when we talk about strokes, when we talk about blood pressure, those are things that we've studied for years and years and years. So we know what medicines to treat for that we have great. When we talk about treatment for coronavirus, as someone who, is talking to his parents on a daily basis, is in multiple different WhatsApp groups, I have seen so many different things out there. And I will tell you that a lot of those things, they're kind of just, people's ideas, but not necessarily proven at all. In the medicine world, when we talk about what actually works, we talk about very hard scientific data, meaning that we've done studies that are at least usually months and very extensive. So, again, being part of these WhatsApp groups, what I've seen is that you should only eat garam pani or drink garam pani, eat garam food, meaning only eat warm things, only drink warm foods, and then you will be completely fine. That has nothing to do with coronavirus. The other thing, people talk about taking different types of vitamins. And so people are investigating those things, but so far, nothing has necessarily been proven to stop any of these things or to do treatment. So when you see on WhatsApp, you'll see methylene blue, you'll see ivermectin. Again, some of these things are actively being studied right now, but as of yet, none of these are official treatments or something that we can really recommend. So, if you go to your doctor, you talk to your friend and say, well, this is what I wonder, this is what I heard from somebody. I will tell you as somebody, again, who's been dealing with this day in and day out. This is all I do for a living. None of that has been proven to be true thus far. And so the treatment that we have is actually very, very small in terms of what we know. So what I'm going to talk about is what happens when you go into a hospital after already being diagnosed with COVID and what can happen. And this is exceptionally scary right now, because when you go into the hospital now, you're by yourself. Your family cannot come and see you. Nobody can come. It's just the doctors. And so everybody has a million questions and what should happen. And so what we do know is that there is something called remdesivir. Remdesivir is an antiviral treatment that has been shown to be very similar to what is Tamiflu for people when they have the flu, to kind of lessen the severity of symptoms. So it is not a cure. We do not have a cure for coronavirus. Anybody that tells you that this is a cure is incorrect. We do not have a cure. Remdesivir, again, is an antiviral medication, and that will lessen the severity. And that has only been proven for people who are mildly sick, but still need to go to the hospital. Then for people who are critically ill, meaning that they have to go to the ICU, potentially end up on a ventilator, potentially need oxygen, any of those types of things, what has been proven to decrease mortality, meaning reduce your risk of deaths, that has been steroids. So we've known about steroids for years and years and years, and we use it for multiple treatments. Steroids also works in COVID-19. It decreases the inflammation and it decreases your risk of death. So most physicians, as soon as you get into a hospital and you're started on oxygen therapy, you will be also started on steroids. The other thing that we do know is that when you are sick with COVID, that sleeping on your belly actually helps significantly. And the reason it does that is because it helps your lungs expand in a certain way. And so you do that, several times a day for at least 30 minutes at a time if you're able to. So we know those are the two treatments that we know work 100%. They will not be cures. So even if you receive those treatments, it doesn't mean that you're going to be cured from it. But those are the only several treatments that we have that we actually know that works. Outside of the hospital, if you are diagnosed with coronavirus, it does not mean that you need to be started on antibiotics. So a lot of times people will say that they have coronavirus and it's called COVID pneumonia. So when you think of a pneumonia, you think of, oh, well, I have to take some type of antibiotic for that. When we talk about pneumonia can be caused by two different things. One is usually a virus, and the other one is bacteria. Antibiotics are for bacterial infections. For viruses, there aren't really any antibiotics. What can happen is some people can have COVID pneumonia and another pneumonia on top of that due to a bacterial infection and need antibiotics. But otherwise, you shouldn't just be automatically taking antibiotics. Again, there's not much that we can do for coronavirus. What we can do is, again, even as an outpatient, you can be at home and you can be sleeping on your belly. Like Dr. Gita was saying, some people do have pulse oximeters, and that is something to measure your oxygen levels. So it's usually a probe that just sticks on your finger and it'll tell you what your oxygen levels are. Some are more accurate than others, but typically if you're starting to go below 90, that's when we advise you to go at least either see your primary care physician or at least go to the emergency room. Now, the other thing is that President Trump received something called a monoclonal antibody. So the trade name for that is Regeneron. So there's Regeneron, and then there's another one that's very similar to that. That is something that you don't get in the hospital. That is for mild to moderate symptoms that can be managed in the outpatient world, and that is an IV infusion. Every state is doing it a little bit differently. Here in the state of Maryland, you go to your primary care physician. If they believe that you have those type of symptoms secondary to coronavirus, then they have to fill out some forms. And after they fill out those forms, you will be then selected to go to a certain area. So here in Baltimore, we go to the Baltimore Convention Center and you receive an IV infusion of this. And that has also been shown to be beneficial. Now, some primary care physicians are a little bit more aggressive in trying to fill out all of this paperwork and do that for you. Some others are not. So I would say that you need to advocate and ask them about this. Because again, it's different in every state and there are a limited number of doses. And so just like everything else with Corona, we have a short supply and we're trying to allocate it to the people that need it immediately. And every state is doing it a little bit differently. Unfortunately, we don't have any federal, national, uniform policies on all of these things. But those are the treatments that we have right now. Everything else, honestly, the focus has been on the vaccine, and rightfully so, because like Dr. Geeta said, that is going to be the light of the at the end of the tunnel. But that is not going to fix any of the things that are actually happening right now. So typically, if you've been exposed to somebody with coronavirus, you're not going to be experiencing symptoms for at least 5 days, meaning that in that time frame, you could be infecting the rest of your household and you could be infecting other people. And what the primary thing that we really, really need to be focusing on is prevention. And I know everybody is tired and there's a lot of politics involved in all this stuff. I will only tell you the same advice that I give to my parents. So I would not go eat any restaurants right now inside because the air is not being circulated. Those restaurants where they have tents and there's a heat, I would not go and sit in a tent right now and eat at all either. Because what ends up happening is you're taking off your mask and you're breathing all of these particles into the air and they stay there for an extended period of time. It is very, very easy to get infected. There are many birthdays going on right now, many anniversaries. You haven't seen your friends in a while. Oh, they haven't seen anybody. We haven't seen anybody. Let's go ahead and get together and meet. While you meet, what ends up happening? Oh yeah, I saw my son last week. I saw my other, they just stopped by for, just for 1 hour. We just, we got together, it was okay. So then it's not that you're not seeing anybody. You're seeing somebody, some people, sometimes here and there. All of these things, it's only going to continue it. And having the vaccine is not going to stop you from getting, from people getting sick right now. And the other thing that you have to understand is that in the hospital, what ends up happening is that our system is getting overwhelmed with coronavirus patients, but people are still getting sick with other problems too. We only have a small, if you think about a circle and the amount of resources you have is very, very finite, meaning that we can't just, even being America and being, supposedly the richest country in the world that can treat everything. If there's a limited amount of supply, which there is in everything, if I have to take care of these 3 patients, that means that I don't have time to take care of the other patients that are also coming in. And so when they talk about the number of deaths, it is actually a much smaller number because there are many, many people who are not getting the adequate treatment that they're supposed to because there's a lack of resources, meaning beds, meaning doctors, meaning nurses. We are all overwhelmed at this point. And the only way all of these things are going to stop is for right now, badlu band karwani, meaning we shut down and we just do the basic type of stuff until we can all get vaccinated. So again, we are focusing on the vaccine. I am telling you that the treatments, and to reiterate, the treatments are remdesivir, steroids, and the monoclonal antibody. Nothing else right now. There really is no other treatment. I wish we had something else, but the fact that we even have these treatments in 1 year is amazing. When we talked about a heart attack and we talked about just that baby aspirin, it took years and years and years to come up with that. In 1 year, we've been able to come up with 3 different treatments. So that itself is remarkable, but they're not miracles. They're not going to fix everybody. And some people, even if they have coronavirus, they will feel fatigued, they will feel short of breath, they will feel tired, they will feel a little bit foggy for months on end. It is taking months for some people to recover. And while we know that the elderly are definitely affected more than others, I will tell you personally, I have people who have been 30 years old, 40 years old, no other health problems, and they die. Okay, so when we say that this isn't a disease that only affects the elderly, I am telling you, I have personally had to call people's parents and tell them who are my age, they already passed away. And the question is why? And again, to be honest, we don't know the answers. So until we actually know the answers, we have to do all of these basic things. That is why When we say we are the experts, it's because we are having to see it day in and day out. So please listen to this. Obviously, everybody who is joined today is very concerned. So I thank you. And again, I personally couldn't have gotten through this without the help of the entire community. So I want to thank you all for the support that you've shown me over the last year. Thank you so much.
Thank you, Dr. Shade. We appreciate your insight to what you are going through as a frontline worker. So the last speaker will be Dr. Kaushal, and Dr. Kaushal is a medical director of the Critical Care and MedStar Montgomery General Center. He is board certified in internal medicine, pulmonary medicine, and critical care. Thank you very much, Dr. Kaushal.
Thank you again for this opportunity. I'm glad I was able to present, and thank you for the other speakers. I mean, very nicely laid down. You know, my talk is going to be a little bit more focused on vaccine itself, but you know, just to give you the scenario that is happening out in the battlefield, like Dr. Kinjal said. You know, we are overwhelmed at this time. The numbers in the hospitals and the ICU are still overwhelming. During the peak of the surge that happened back in March, you know, our numbers in my hospital, it's a small community hospital, about 110 bedded hospital with 12 ICU beds. We had to expand the ICU beds to about 25. At the peak, we had about 65 patients in the hospital, and about 22 patients in the ICU. And as the numbers got a little bit better, and now through the second surge, about 2 weeks back, we had another peak of numbers of about 50 inpatient hospitals, and I had 19 ICU patients. So you know, the numbers may look different, but out in the ICU and the hospital, the scenario is very, very different. This time around, like you know, like Kendall mentioned, we are burned out. We've seen way too many deaths than we have throughout our entire medical career. There's a shortage of everything, mostly staffing. Staffing is burned out because they're working overwhelming. There's overwhelming amount of emotions and death that is involved. So you know, we are pleading. We've been trying to reach out through various media. You know, the only treatment, like he said, is prevention. That's the only thing that works. All of the treatments that we have only a modest effect, if any. Once people make it to the ICU, it's anybody's guess who's going to make it alive out of that ICU. It does not matter how young, how old, how healthy, what underlying medical conditions you have. Anybody who hits the ICU with a severe COVID illness, I already give them a 50% chance. And after that, it's a long battle ahead for them. So it's been a very, very depressing time. And like Dr. Geeta mentioned, it's you know, it's more disproportionately affected people, Black people and people, Hispanic origin people. So with that, I mean, if you can play my slides, I'll just run through mostly the vaccines, and we can answer most of the questions that they have. Now, I don't have no financial disclosures from me. Next slide, please. But I do have personal frustration against COVID. That's my only disclosure. Next slide. So currently, there are 5 vaccines that are under phase 3 trial. Well, phase 4, 2 of those in phase 3. The AstraZeneca, the Janssen, and Novavax has been approved by FDA to go under, and they're currently undergoing phase 3 trials. The last one has been approved by MHRA at the United Kingdom, and you know, 2 of these are mRNA, which have been approved. Completely new technology, but we have been studying this technology for over almost about 30 years now. And the other 2 viruses, AstraZeneca is the one that is currently has been approved in India, that is being made by the Serum Institute of India. And the other 2 are currently being developed and going through phase 3. Next slide, please. Now, the big question is, do you really need vaccination? I mean, people feel that it's towards the end of the pandemic. You don't know what effects it's going to have. You have apprehension about the short-term and long-term side effects. Just a perspective of this thing, looking at your age, and the comparison was made between the age group of 18 to 29. As as you grow, every decade you go above these, you can see the risk of hospitalization and the risk of death after 65 is almost 90 to 600 times higher of dying from COVID if you catch COVID. So just giving you a perspective, this is one of the reasons why older people definitely would recommend vaccination. Next slide. If you have any underlying condition, if no health condition, you still have a high risk of dying, about a 1% chance without any underlying medical condition. But as you have these medical conditions, especially cardiovascular health, hypertension, and diabetes, one of the biggest risk factors, there's a tenfold increase in the risk of dying from this thing. So if you have any of these conditions, definitely should consider getting vaccinated. Next slide. Can you go back to one? Yeah, I mean, most of the, how are these vaccines working? So vaccines are not injecting viruses. These are not attenuated viruses. These are not live viruses. What we're using, most of these viruses that are being currently tested in the United States are targeting the spike protein that we have. The spike protein is right on top on the surface of the coronavirus, and we are trying to introduce this and expose our immune system to this spike protein through 3 different mechanisms currently. And the hope is that once your immune system is exposed long enough, that it will develop immune cells. And some of these immune cells have memory, we call them memory T cells and memory B cells that can last in the system for months, sometimes years, even decades. How long, we don't know as of yet. Can you take the next slide? So again, this slide kind of explains how once we introduce, this is more of a mRNA virus, we introduce the mRNA into the body, our cells, immune cells and muscle cells will make that spike protein, what I was talking about. This spike protein is then recognized by our immune system as a foreign entity, and then they start making immune cells. Of course, this is an infection, not an infection, but we're kind of creating an environment for infection. So your immune system is getting activated. So you will have some reaction. You are supposed to have reaction, and some of these reactions are actually good. That means that your immune system is actually getting activated through all of these things. So once you make immune cells, our goal is to make T cells and antibodies, but also more importantly, memory T cells, because that will give us a longer lasting immunity against this virus. Now, if people get infected after getting a vaccine, our hope is that these immune cells are present and they can fight the infection and take care of it before it gets or spreads to our lungs or to various organs. Next slide, please. So, the bigger question was, vaccine cycles can take 5-10 years. How come this new technology was developed so fast? Is it safe? And that's the first apprehension that I myself had, and just like anybody else. So, again, giving you the perspective, the mRNA was first talked about 30 years ago. Over the last about 12 years, they have been trying to develop these vaccines against Ebola, against the Zika virus, against even influenza and CMV virus, so cytomegalovirus. But the technology was always there. The only difference that we were able to do this was because of the pandemic. Of course, these are not regular times. Of course, there's a prevalence of this disease, so the subjects that we can try on is just available everywhere. So that was one of the biggest difference compared to influenza, which is a seasonal disease, or Zika virus, which is very regional. This was present everywhere, so they had enormous amount of subjects that they could do the trials on. Second was the funding. The funding, enormous amount of money was pumped in by the U.S. government into all of these five companies to test them at a faster pace. Of course, there was no compromise in how the process of vaccine approval, regulation, and trial is done. There was no compromise in that. It's a very, very transparent method. If you go through FDA website or a CDC website, you can actually see there was no compromise at any of the steps. So just to lay down what Dr. Geeta said, they tested on animal models and in the labs to check for safety. Then phase 1 is when they try it on healthier subjects to see for the safety of the vaccine itself. Then phase 2 is a little more targeted population, people older, vulnerable people. And here we're also testing the dosing. And of course, phase 3 is the larger one in which we do a placebo randomized control trial. Now, next slide. So this is the gold standard of developing any therapeutics, which you may have heard about, is a placebo-controlled observer-blinded trial. So in which essentially what we're doing is we're taking these 40,000 patients, dividing them into 2 groups, and they will randomly get vaccine or a placebo. Placebo is just not a medication, just saline or something simple. And even the patients are not aware of these things, and even the investigators or the scientists or the physicians, they're not aware who is getting the placebo and who's getting the actual vaccine. And that is the gold standard to test for any therapeutic. And this is how both the mRNA vaccines and the other upcoming vaccines are being currently tested with is a randomized observer control trial. Next slide, please. Just a demographic, this is from the left one is from the Pfizer, about 45,000 patients were tested. And the right side is the Moderna vaccine. Varied group, you can see the age range was different. For our specific population, Asians were about anywhere 4 to 5% of the tested population, so not a bigger one. Next slide, please. So effectiveness, again, this kind of lays down how, based on age, based on gender, based on ethnicity, how these slides, how these were effective. And you can see on the last vaccine efficacy, mostly it's been above 95, even 100% at certain points. So very effective across all age groups, along all ethnicities and gender. Next slide, please. So bigger question, that it's been circulating, that it's going to become a part of our DNA and affect us. So, going back to cellular basic microbiology, this mRNA vaccine does not enter your nucleus. That's where your DNA exists. It does not integrate into your DNA, into your cell. The way, next slide, please. The way this mRNA vaccine is going to work is there's a delivery vehicle, which is generally a nanoparticle, a lipoprotein nanoparticle in this case. They coat it with this. The mRNA is a small, essentially a sequence of messages that we enter into the cell, and not the nucleus again. That's where your DNA is. Now into the cell, the lipid vehicle is disintegrated. This mRNA is exposed. Your ribosomes will read these codes and then make that spike protein. And this spike protein is released into the circulation, where your immune system will recognize it and mount the reaction that it's supposed to do it. So once we inject these the vaccine into the muscle, it's the local muscle cells, that's where the mRNA is going to enter in, and some of the immune cells in that area. They last for a few hours in there. And after that, this mRNA along with the lipid vehicle will be destroyed completely. So it is, this mRNA and the lipid will be gone in a few hours out of your body. So after that, it's the immune response that will last for at least 24, sometimes 48 hours. Next slide, please.
Sorry, Manubhai. How many more slides just so we can get to the questions.
I have a couple more,
Okay.
not many. So it'll take 5 more minutes. So main side effects, I think everybody knows. I had it, you know, my colleagues had it, my mother had the vaccine yesterday. It's generally most commonly what you're going to have, very mild pain, tenderness, and swelling at the site. This is very, very light, which can be taken care of using Tylenol or ibuprofen. Symptoms generally will happen after the second, more commonly can be seen after the second dose. Next slide. A quick comparison of the two vaccines. I think there was a question somebody was asking. So essentially, you know, fairly effective, 94, 95%. Both require 2 shots. Pfizer is 21 days apart. Moderna is 28 days apart. Only difference is Pfizer is approved for 16 years and above. Moderna is approved for 18 years and above. Slightly higher dose of vaccination in Moderna, but the efficacy, as you can see, is about the same. And there's a little difference in storage. Pfizer is a little difficult to manage, so will be difficult. Next slide. Some of you asked, you know, if there is interaction. So the biggest side effect that we worry about is severe allergic reaction is the one that we're worrying about. So once you get the shot, you're actually made to sit in the office for 15 minutes because we want to see if you're going to mount an allergic reaction, an anaphylaxis. Severe allergic reaction is what we're trying to observe. So, you know, this is what the components of both these vaccines are. And most commonly, it's the PEG, polyethylene glycol component that a lot of people have allergies to. So if you have allergies to any of these components or PEG particularly, and if you have severe allergies, then you probably have to discuss this with your provider. Next slide, please. A big question. This was you know, a lot of my nurses currently working in the front line were pregnant, and they've been asking whether they should get vaccinated or not. They're not sure about it, and even, you know, this was a personal situation where, you know, my wife is breastfeeding, and we were debating if it should be, is it safe to use it or not. So to answer your question, you know, there hasn't been any study done on any pregnant or breastfeeding female as of now. Of course, some people did get pregnant during the trial, so we will have some data available as time goes by. But as of now, we don't have enough data on human models. Of course, Moderna has done trials on animal models and has shown safety in pregnancy. Now, I do want to very clearly state that the pregnancy is considered a very high-risk state for COVID-19 serious infection. So people who are pregnant are at a higher risk than non-pregnant people to get severe disease, ending up in an ICU or even dying. So definitely, my recommendation is generally, you know, if you're pregnant, you're high risk, I would definitely recommend. But in theory, there is no long-term side effects that should affect your fetus. Next slide, please. Will the vaccines work? Most likely, yes. The mutation is very, very mild. The new 2 South African and the UK variants have very light change in the amino acid, that spike protein, but it's not a huge difference. So yes, there was a study done in vitro in University of Texas that kind of shows the efficacy on 20 subjects. It did show that it works. Next slide. Question, yeah, if you had a COVID-19, if you had COVID-19 infection, do you still need it? So immunity that we know may be there for 90 days, maybe a little longer, but the immunity kind of wanes out over time. So definitely you should get a vaccine even if you had infection. Now, right now, they are not offering for people who were tested within the last 90 days is because of the shortage of vaccine availability. So if you had an infection, we are hoping that you still have some immunity. And as the 90 days pass by, you probably will have a chance to vaccinate. But as time goes by, I think it's going to be available for everyone. Next slide. Again, I think Dr. Geeta mentioned that. I mean, we're way, way, way behind from where our target use should have been. We anticipated 25 million by now. We're down to just 11 or 12 million on Friday that I know of. Next slide. And this is just a quick one word on the other 2 types of vaccines that'll be coming out. Of course, what everybody's going to look for is efficacy. So the other type of vaccine, the AstraZeneca vaccine, it uses a viral vector. So instead of a lipid nanoparticle, it actually uses a chimpanzee adenovirus, which is non-replicated. It's going to go inside your cell, but it's not going to replicate. It's going to get destroyed. But it'll give that mRNA to the cell, and then mRNA is going to be interpreted the same way as it is done with the mRNA vaccines. And the third type of vaccine that is going to come out, that is Covivax, is going to be on the spike protein itself. They're going to coat it with a lipid protein, and they're going to inject it. That one, I don't know if it's going to mount a lot of reaction, because the protein and the lipid delivery, they get destroyed very easily. So that was my talk, but we'll open up the session for any questions.
Thank you, Dr. Kaushal. So Dr. Shed has been answering some of the questions from the chat box. So I will go through some of the questions again anyway, just to make sure. So the first question was, can you speak about the mutated version of the virus? And I think you did address that with that the mutation is minimal, and the vaccine should cover the new mutations based on the study done at University of Texas. And then the next question was, why do you have to wait for 90 days? Again, I think you've answered it, and Dr. Shed has also answered it in terms of that the vaccine, the antibodies, we think it lasts about 2 to 3 months. We're not sure. The next question, the main difference between the two vaccines, I think you mentioned about the two different, they're both microRNA. The one question that I had as a Jane is that I've read that they are using horse serum of some kind of thing. So it's not Jane. Is that something that we should be concerned about? I know the influenza vaccine uses egg products, and there have been people who have refused to take it because of egg allergies and so on. I don't know if you know anything about for this vaccines. So you're on mute.
I didn't come across any of that, but I can't answer that question. Sorry.
Okay. All right. Then another question was, can the doses be ordered for the JSMW Samaj? I think we had heard that the BAPS community is trying to order it for them. So we wanted to know if that was possible.
So as of right now, everything is being done via the state and local governments. So again, there's a lot of kind of talk out there that, you know, we're getting it for this group, we're getting it for that group. Honestly, like majority of it's not true, and it's different in every locality. So if you look at Florida, for example, they've kind of opened it up to certain groups, but they're doing it kind of, and you just show up and it's on a line basis. Here in Maryland, we are doing it right now. We are in phase 1A, and phase 1B starts on Monday. And there's a registration process that you kind of get a link to and you drop down. So most state and local governments are doing it that method, where you kind of register online and then they kind of send you an email when you can get it and where you can. Another thing is, just because both the Moderna and Pfizer vaccines, they require certain temperatures for the vaccines to be stored at. So they can't be done at your local pharmacy or local PCP office. It's going to be usually in some kind of healthcare facility or like state government office where they have those storage facilities for the vaccine.
Okay, that makes sense.
I just want to add in that I'm on the state advisory committee kind of through the health department. And I brought up this question maybe a few weeks ago, doing through the temple or churches. But as it has been mentioned, that the problem is the storage and the process itself. But what we hear now, that more like even President-elect Biden mentioned plan to open up more places like community centers or school gymnasium, etc., etc. But the most important thing is these two vaccine requires the storage, which is very specific. Otherwise, it needs to be thrown away, and it should not one sample should be thrown away because it's badly needed. So just follow what we need and get your vaccine. Thank you.
Okay, thank you, Dr. Gita. So the next question we had, I'm sorry, I'm just scrolling through all that. So another person had, is the vaccine a one-time that like we take it now and we'll be like for the measles or smallpox, we don't have to take it repeatedly, but like the flu vaccine, will we have to take this on an annual basis?
So right now, go ahead, sorry.
As of now, I mean, the data is, with 4 months out, we don't know. I think more data is going to come out in the coming few months. We're going to know how long the immunity is lasting. But just like any other vaccine, we may need a booster in a year, maybe, I don't know. We'll have to see. Only time will tell us.
Okay.
And the one thing that I do want to emphasize is that there's been a lot of discussion, especially in Europe, and then some of the other states have also been talking about it, that only doing one shot and the second shot you can get later on. So you can get it, so the Pfizer vaccine, you get 21 days after, the Moderna vaccine, you get 28 days after. Now, some people, just because of our lack of supplies, they're talking about maybe getting the second dose much later on or not getting the second dose at all. So I will tell you again, as from the scientific community, the studies are not actually tailored to those things. What we do know for this to be 95% effective is that it actually you have to do the 2 shots and you have to get it in the time frame that's specified with each vaccine. So it's not something that you just get one shot and you can wait later on, or and also you have to get the same dose. So if you got Pfizer before, you go get Pfizer the second time. If you got Moderna the first time, you'll get Moderna the second time. I think the other concern that a lot of people have is that, oh, my friend got the Pfizer, I got the Moderna, which one's better? They both work the exact same way in terms of the mRNA technology, and they're both essentially equally as effective. And I will say, just because I've had other relatives ask me recently that out of Norway, there have been some deaths from the Pfizer vaccine. And so people are a little bit scared. So right now, it's just what we call a causal relationship, meaning that people who had the vaccine, they did die afterwards, but we don't know if it's a cause and effect, that the vaccine actually caused those deaths. They're investigating it. So again, I urge everyone, as soon as it is available to you, to get this vaccine. That is the only way we're going to actually have a light at the end of the tunnel. I personally have gotten both shots. I've been very fortunate, but still, because I got both shots, I can't just go around and do everything. I still have to do all the precautionary measures and things like that. So, but I encourage everybody to make sure that you get both shots.
So I have a follow-up question to that. So you said that you've gotten both shots and now you've completed the 2 and you're still doing the precautionary measures. Do we know how long we have to do this? Like, just because you get the shot doesn't mean that you can go out and start meeting everybody and doing whatever. So
right. So you probably heard a lot in the news, something called herd immunity, right? And so the thing is that this vaccine is 95% effective in terms of me not getting sick from coronavirus. It doesn't mean that I can't catch it. So right now, I could go spend some time with a COVID positive patient, catch the disease, and then spread it to anybody else that I see. So unless the other people that I'm around have also been vaccinated, then I can stop all my social distancing measures and things like that. But until then, I can't. So everybody needs to get vaccinated because, I'm not just here to protect myself, I'm here to protect everybody. And so I don't want to see my parents if they haven't been vaccinated, because like I said, I can get the disease and spread it to them. It doesn't prevent me from catching COVID. It just prevents me from getting sick if I do get COVID.
So my parents are in the they're over 75, so they will get it soon. I've received it because I'm a healthcare professional, but my children are early 20s, so they're probably in the lowest group. So until all of us in the household get vaccinated, we can't do a lot of intermingling. I mean, because they don't live with us. So we still have to maintain those same precautions, is what you're saying.
100%.
Okay.
That is very important for everybody to understand, that the vaccine does not change, the mask wearing, the isolation and hygiene. It has to continue the same for at least a few months.
Right. The vaccine does not prevent transmission. Yeah. So you can still spread it as much as you can to everybody else. It doesn't stop you from catching COVID. It just stops you from getting sick from COVID.
And remember, every person will mount a different immune response to this vaccine. So some people who may be on immunosuppressants or whose immune system is not as strong may not mount that response and may not have the 90% efficacy in some patients. So we don't know at this time. I mean, of course, they're drawing blood and they're checking how good of a response people are getting based on different age groups and this. So, you know, you may not have a 90% efficacy if your immune system does not recognize that antigen.
So I want to ask both our co-speakers. First dose brings us maybe 80% response in our body, and why I would not take second dose, which might be questioned in so many people, especially if their arm hurts so much and this and that. So second dose where you get really neutralizing antibody, which is most required to fight the infection. And it is very important if you decide to take, which you should, somebody has to be really deciding whether I want to get COVID or I want to get vaccine. And then you should answer your own question. And when you take vaccine, make sure, put everything aside, follow the instruction, what has been given here, what you read, etc., but make sure you take both the doses. And don't hurry to have a party at home because you didn't have a party for last 12 months or more. Wait, let everybody get vaccine. And what has been mentioned about herd immunity, at least what I have read and what we know, 70% of population minimally get vaccine. And right now we know children below 16 or 18 are not going to get vaccine. We know that already. Right now, it can change tomorrow. So really, let's just stay home, take care of ourselves, but don't hurt anybody else also. Thank you.
The thing that I want to definitely add on to what Dr. Geeta is saying is that, you know, a lot of people are definitely concerned about the long-term side effects of the vaccine. And again, to be 100% transparent, we don't know because we've just investigated this vaccine now. So we don't know what's going to happen 10 years from now. People are concerned that it's going to alter your DNA. That is not the science. That can't happen. Could there be other potential side effects in terms of an immune response and things like that? Definitely can. I will admit that there is definitely an unknown out there. I will also tell you that I know what happens if you get COVID, especially for the elderly population. You will die. There's a very, very high chance that you will die. So, you know, my parents are in the elderly population. I frankly told them, I don't care what happens 10 years from you, from a shot that you're getting today. I don't want you to catch COVID. So I know what happens to that. So when you think about the risk between, you know, getting the shot and catching COVID, think long and hard because, you know, let's say, you know, you're in your 20s and 30s. And yes, there are many 20s and 30-year-olds who are completely fine and don't feel symptoms. There are also many 20 and 30-year-olds who catch pneumonia, didn't need to go to the hospital, but they don't feel good and their lungs are not the same. And now you're 20 and 30 years old and now just going up one flight of steps for the rest of your life is going to be very, very difficult. Is that how you want to live life? I don't think most people would answer yes to that. So I will tell you, as much as you may be scared about the vaccine, COVID should scare you much, much more.
So I just wanted to add a little about, I was reading some information, and this is more for the participants to hear. But the virus, the vaccine, the reason why it was so quickly in terms of being rolled out within a year is that, as Dr. Kushal mentioned, the research has been going on for many, many years. But what the two, the Pfizer and Moderna, what they did was they went ahead and manufactured the doses even while they had submitted for the FDA approval. So usually you get FDA approval and then you manufacture the doses. They took a monetary risk that it will be successful. And then, so that's why it was so quickly. We got the approval and then it was able to roll out. So it wasn't that they were cutting corners. It was just, they were taking a monetary risk that it was gonna work. And if it didn't work, then they would have lost those billions of dollars in terms of manufacturing doses that were useless, so. I don't see any more questions. There were some questions. What are the difference between the vaccine in the USA and other parts of the world? And Dr. Shet answered that. Right now, most of the world is using Pfizer and Moderna, but AstraZeneca is also out there, but it's using an adenovirus, which Dr. Koshal had mentioned as well too. And then we put up the site for Montgomery County, Maryland. There is a website you can pre-register, and I've pre-registered my parents onto that. So the link is there, so you can copy it and do that for Montgomery County. I don't know for other counties in Maryland. So,
right. So honestly, because my parents live in Virginia, but every place is different. But honestly, if you just Google whatever state, whatever locality you're in, like, so, if you're in Montgomery, you could just Google Montgomery website to register for vaccines. So it would be that. In Virginia, my parents live in Henrico County, so it's say Henrico. But if you Google it, it'll be the very first thing that comes up. But I encourage everybody to if you're on this meeting right now, that means that you probably are a little bit technology savvy. So I'll just go to Google. That's what I would do to get into your area.
So
every county has a Giant also is going to open up. So 65 plus we'll have from 25th and 75 plus from 18th tomorrow. And Giant has multiple locations. I printed before yesterday those Giant locations, one in Upper Marlboro, Bowie, Maryland, and every county has that. So please inquire if you have a hard time to get on one of those links, go to Giant and find out. And we can put that paper on the WhatsApp or whatever. So thank you. Find a place to go and do it.
My mother lives in Virginia, and they're a little ahead. So she did get her vaccine last week. It was through her primary care. So we were at the primary care and we requested them. And they just happened to have the vaccine available. So that was one of the ways she got hers.
That is excellent. I don't know how many primary care are ready to do that, but I'm happy to hear there are few devoted ones. But thank you for sharing that.
The one thing I'll say is that a lot of places, while they're in their different phases, sometimes some people are not showing up for their vaccines. And once the vaccine has been taken out of the storage, it has a shelf life. And so if people are around, they'll literally just kind of walk out into the hallway and say, does anybody here want the vaccine? And then they'll just give it to whoever's there, because they don't want to throw the vaccine away, obviously. And so some people are also getting lucky. So you will hear stories about that, and that's how they're doing it. So I'm not saying to go to these facilities and just wait around all day, but if you happen to be near one, and especially towards the end of the day, if people didn't show up and they have that vaccine, they're not going to throw it away. They're trying to give it to whoever's walking by. I mean, again, it depends on your locality, but some places are definitely doing that.
So,
and one last thing, it is free.
Yeah, that's what I was going to ask. Will the insurance cover it, or will it be free? So Dr. Gita answered that question.
Yeah, but I read yesterday that some of the places are going to charge Medicare and Medicaid, but we don't need to worry about it. But public will not have to pay 1 penny. Okay. So if somebody asks you copay of $25, there is a problem. You are not supposed to pay.
So one of the questions that I had asked was is the product, the vaccines, Jane, in terms of no using animal products? And Dr. Pavan Zaveri answered that from what he's read and what he's heard, is that there is no use of animal products in these in the vaccine. So it is Jane friendly. So good to know. So
yeah. Sorry, I also looked at the ingredients. There's nothing in there. The one thing that you do want to make your whoever's giving the vaccine is that if you've been allergic to other vaccines in the past, a lot of the ingredients are very similar. So if you've been allergic or had an allergic reaction, then there's a potential for you to have an allergic reaction to this vaccine. So, and those small percentage of patients, they may consider it, but even then, majority of people are usually pretty safe, and you can, they'll watch you. If you do have any reaction, they'll kind of give you an epi injection, but most people have been okay. I mean, I can tell you at my healthcare facility, we vaccinated close to 6,000 or 7,000 people already, and we've actually had 0 reactions this far.
Yeah, when I went in to get mine, they asked me if I was allergic to the SARS-CoV vaccine, and I'm like, "Are you kidding me? I don't know because I've never had it." So
Yeah, they probably asked it the wrong way, but I think what they meant was, have you ever had an allergic reaction to a vaccine in the past? That's the more appropriate way they should have asked.
So we have about a couple more minutes left if anybody has any other questions. But I think our three physicians have answered most questions that anybody had. So we learned.
One thing I want to reinforce again, people who will be getting the vaccine, do expect that your immune system is going to mount a reaction. So you will have some body aches, some low-grade fever, chills. You will have a local pain. Some people have experienced some nausea, even some diarrhea. So this is all expected. So you will get this thing. It's not that you're having a bad reaction. So just taking over the counter Tylenol or Motrin should help through that. And generally, the reaction will last about a day or two at max, more so with the second dose. But do expect that kind of tells you that your immune system is getting prepared.
So one question was that she just had a reaction to the flu vaccine this year. What precautions should she take? She had not had I guess I'm assuming she had not had the flu vaccine, the reaction to a flu vaccine previous years, but this year she did. So.
Well, so it depends on what type of reaction it is, because just like Dr. Manu was saying, is that a lot of times people will have a soreness at the site, they'll have headaches, they'll have fatigue, all of those types of things. And so that, again, is not necessarily a reaction. That means that your immune system is developing the antibodies, and that's a normal physiological response. It's kind of like when you go out for a run, you all of a sudden feel your heart racing, you start sweating. It's not that you're having an allergic reaction to the run, it's because your body is kind of appropriately responding. In the same way, when you get a vaccine shot, it's kind of like your internal organs going for a run.
So our pharmacist, she always reminds all the healthcare worker when they were taking vaccine that there are side effects and there are adverse reactions. There are two different things. And side effects, which we all three of us mention over and over again, is a fever and local pain and whatever. Those are which goes away in hopefully 24 to 48 hours. You might need to take one Tylenol or whatever, try to rest, all that. Adverse reactions, which are being monitored right now over the time, then answer will come, hopefully positive after a few years or whatever happens. Those are let's not get confused between two things. And one person who has an anaphylactic reaction, that's the group, or severe allergic reaction, that's the group who should be really cautious. I'm not saying should not take vaccine, but they will be monitored when they go. They will be monitored for extra time, and they will be given some more instruction. Thank you.
50 right now. So I think that's pretty good. So I wanted to hand it over to Sharad Bhai so he can to speak to everybody. If Sharad Bhai can come on the air.
Can you hear me, Minava?
Yes, we could hear you. Yeah.
Okay. Jai Jinendra, everyone. I'm the Sharad Doshi. I'm the president of Jain Society of Metropolitan Washington, D.C. I wanted to thank you, especially our first line responders and the members who are serving our community during this pandemic. They are the true hero and dedicated people. So thank you, everyone who's in the field. Secondly, I wanted to thank you, Dr. Seth, Dr. Kaushal, and our Geeta Ben Shah to give us the insights and tips on how to react and handle the COVID-19 during this pandemic. So thank you so much, all three of you, for giving us the time and information. So bottom of my heart, Thank you so much. Wanted to thank you, today's Woman Club, especially Shilpa Ben and Minal Ben and many other members in the community, in the group, to bringing such a valuable information to the during this tough time. People have a lot of anxiety and going through many challenges in a family. As mentioned, that there are a lot of information, but there is a information not verified unless you hear from your professional doctors or physicians or pharmacists or developers. So thank you so much for the today's Woman Club, the members, bringing this valuable information. And I wanted to say, stay safe, keep safe. And Jai Jinendra, as we get many questions about opening the temple, since the vaccination is out, but we have a team of people who are working and monitoring continuously that how we can keep our members safe. So we will keep you informed. And lastly, Shilpa Ben, if you can, this recorded message share with us through our EC, so people can view it. They'll be very, very helpful to all the members who could not attend it.
Sure,
Thank
I
you
can
so
do that.
much, and Jai Jinendra. Thank you.
Yeah. Thank you once again to all the doctors and the panelists. Really appreciated your time. And last whole week, we've been going texting back and forth. So thanks for all the time besides your busy schedule. I really appreciate it. And I'm sure a lot of members are appreciating all your comments. Thank you once again. Have a great and safe day off today.
Thank you for the opportunity. Please be safe. God bless you all.
Thank you.
Thank you, everybody.
Thank you, everybody. And Shilpa, have more sessions like this frequently while COVID is ongoing, maybe in 3 months or 4 months. Keep people safe, our community safe. And thank you, both young doctors. You are like my kids. So thank you for keeping me updated. Thank you.
Thank you so much.
Thank you for being an inspiration to us.
Thank you for the excellent session. We learn a lot. Thank you.
Thank you.
Thank you.